안녕하십니까?
Hello,
닥터스틱
this
이지
is
홍조원의
Dr. Kim Kyung-won. Today, I'm going to talk about MS Kit. MS Kit is for the mandibular anterior side, narrow ridge, and if there is a small space, then you use the MS fixture, the narrows implant from Ostem. And it's one body implant, and this is for such purpose. So what are the characteristics of this kit? It has two types of parallel pin design, conventional type, and the other one is on the upper part. The MS fixture's upper part, it looks the same. It has the same design parallel pin. So after drilling a hole in the mandibular anterior, you can put this pin and design the path and other things to fit your final prosthesis. Another characteristics of this kit is that it allows for easy and simple drilling sequence. For example, 2.5 narrow ridge or other. If you put in the MS fixture, you mark with the lens drill and then drill with the twist drill, and with two drills you can put in the fixture, so it has an easy and simple sequence. Third characteristic is that MS fixture, because it's one body implant, within the orally, the upper part exposed, and after placing implant, immediately you have to create temporary prosthesis because you feel that pressure, sometimes too much torque. And in such case, between fixture and driver, there could be jamming. And if you have jamming, then if you try to take it out with force, then the fixture can lose its initial stability. And to prevent that from happening, we created appliance called separator, so that between fixture and fixture driver, if you have jam, then with the lever action principle, you can easily separate the two. So it's a special tool for that purpose. So just in case if you have jamming, you can still use this safely. This is how the kit consists. It has two tools. First, to place implant, you have tools for drilling, and to place fixture, you have the installation tool. And for MS fixture, what are the characteristics? Of the MS implant fixture, narrow implant has SA surface, so like TSA. And fixture and abutment is connected as one body. It's a one body implant system. So one stage surgery is possible, and you put it in the tissue level, and the recommended torque is about 30 Newton. So because it's one body system, because of temporary prosthesis, if you push too much torque, it could become a problem. So you have to be cautious not to do that. And you can install implant using MS Kit, and it has 3 diameters, and length comes in 4 types, 8.5 to 13 millimeters. And here, gingival height, because it's one body, has 2 types, 2.5 and 4.0. And in the past, MSRBM surface was used, and some still prefer it. And if it's needed, that surface is also available. And implant denture type it uses O-ring, and it can use for overdenture. It has you can use overdenture O-ring attachment, and diameter is 2.0 to 3.0. Length is from 8.5 to 13 millimeters, and gingival height for implant denture type 2 type 2.0 and 4.0. And for you have implant for provisional prosthodontics, like if you use TS and as others for as a final implant, then if you cannot put temporary in there, then as a provisional, this implant can be used. And this one, the neck portion, can be bended. So on the position you want, if the implant cannot be placed, this can be used so that you can bend the neck and use as a provisional. Diameter 1.8 and 2.5, length 10, 13, and 15 is available. And I will now talk about drilling tool. First is lens drill. As you are familiar with this, to place implant, you use this for positioning and marking. And for lens drill, you have a long type lens drill with stopper. So if you push in the lower anterior, if there's not much space, it can have interference with adjacent teeth and drilling might not be possible. So we have two types, short, non-stopper, and also we have long stopper. So it's a longer version. So if you drill, you can go up to 26 millimeters, so there will be no interference from the adjacent teeth. Next is parallel pin. As I briefly mentioned, parallel pin, you have conventional type, and also, even in that structure, to check the millimeters more easily, you have the thickness difference for comparison. And one thing as a special, on the upper part of MS fixture, it has the same design. So it has the same narrow fixture design, so that in designing final prosthesis and planning that you can use this as a reference or guide. And also on the upper part, laser marking is there, so you can check also the overall total length. And to place MS fixture, twist drill is the basic drill to be used. There are 3 types of diameters. And also, as lens drill, if you place in the narrow area, there could be interference from adjacent teeth, so you have short and long type, and laser marking like in other O-stem implant, so a bit thick black laser mark. The bottom is 10 and 15 on the upper part. Twist drill sequence is like this. Now, for example, if 2.5 you have a provisional ridge type in the normal bone, the final 1.8 twist drill is recommended. 3.0 implant, the final drill would be about 3 drill, and because we push in the lower part, soft bone is a bit different, but it's a similar approach. So let's say if it's same dimension, initial stability might be weaker. So it's not very often where MS type is used for the soft bone. So if possible, maybe shorter sequence might be better. And in the mandible anterior, it's very hard bone. So in such cases, then for 2.0, maybe final drilling is 1.8, and 2.5, maybe 2.3, or 3.0, 2.5 drill. So my experience is, even if it's hard bone, rather than use final drill in full length, use a shorter one. So in the MS implant, in the 1x fixture, initial stability can be adjusted by you. So basically, in case of MS fixture, the gap is less than 0.7, so a bit narrow. So if you push 2.5 implant, 1.8, 3.5 implant, final drill could be 2.3. That will be like the basic approach. And depending on the bone quality, you can make the necessary adjustments. Next is drill extension. We talked about drill length. You have shorter and long version, but in case of mandibular anterior, where it's narrow, so adjacent teeth interference could make drilling tricky. So in that case, you could use drill extension. So if you connect this drill extension, then you have added 6.9 millimeters of drill length. So This means in most all cases there will be no interference from adjacent teeth, especially mandible anterior side. The extruded teeth has a lot of bone absorption. There could be more interference. So if you use drill extension in such cases, drilling will become easier. Next is depth gauge. So it's a basic gauge that you would know, but it's a bit narrow, thinner because you go into a narrow space. And on the other side of depth gauge, there is a special thing attached. This is for provisional MS implant. For that fixture, could bend. So this is tool for bending. So on the opposite side of depth gauge, you have that available. And how it's bent, I will tell you in the hands-on session. Next is engine-driven driver for installation of MS fixture. You have short and long type, and for the denture type, you have a bit of notch or hole at the bottom. So denture type or with other types, you could distinguish. And I will show you again the hands-on. But this engine-driven driver like this black triangle part, you connect to the flat part of the fixture, then it will be easy to place implant. Next is torque driver. You have again short and long version, and again the black triangle laser mark can be used for positioning. For denture type, as before, on the side there is a small hole, so you could use that for reference. And then you can use without getting confused. Next is MS torque driver for denture. And I will show you in the hands-on also, but for provisional type MS implant, if you bend too much, or if you want to change positioning of the already bended one, then provisional type MS fixture sometimes fractures. And to remove that, it can be challenging. But fortunately, for provisional implant, not upper part, but in the below neck, in the bending part, it's same type as the denture. Therefore, this denture type torque driver, if it's used very easily, the fractured provisional type MS implant can be removed. Again, I'll show you this in the hands-on session. Next is ratchet wrench. This is very basic tool that you would know, one directional ratchet wrench, and you can use it hand wrench. And one more thing I want to tell you is that in case of mandibular anterior, for MS implant, pitch is 0.8. This means that hand wrench, if you do one turn, then about 0.8 implant advancement happens. So in case of one turn, 0.2 millimeter advancement. So if you want to advance 1 millimeters, one turn plus 90 degrees in addition. So depending on 90 degrees turn, how much advancement is made? 0.2. You have to be mindful of that to adjust your depth. And I said before, just in case, because it's one body implant, if you have excessive torque, then one body implant in the torque driver, there could be jamming. And in case if you have jamming, if you try to forcefully take it out, the one body implant's initial stability can be broken. So separator, we have a special tool. And if you have jamming, then you just put it in and you put it out using the lever action principle, then very easily fixture and driver can be separated. So that's how it's designed. So even if there's a jamming very safely, it doesn't hurt fixture stability. Next, I will go into hands-on practice. The model that I prepare for you today is number 41 is missing, and here using MS kit in the narrow ridge type MS fixture 2.5 by 11.5 millimeter implant will be placed on the lower anterior area, and then provisional type 0.5 times 10 millimeter will be placed on the lower molar area. So I'll show you how the provisional prosthesis is bent, or if there's a fracture while bending, how it's removed through hands-on. I'll show you. So this is the case. 41 is missing. For that case, first I do incision drill, and then MS fixture will be installed. I will see you in hands-on practice. So now I'll do hands-on for MS kit. 41 is missing, and 2.5, the length 11 millimeters MS will be placed first in the missing area. It's been a while since the tooth was taken out, so it's a healed ridge. So I'll do crystal incision toward the lingual side. To the adjacent teeth, I will release and open the flap. So just for easy hands-on, I will do suturing and tagging suturing. And as you can see, on the lower side, in number 41, like this, I open the flap, and the thickness here seems to be sufficient, and I'll use lens drill and mark the drilling position. So lens drill is used. Generally, when you put in the lower anterior side, there's a lot of case where the ridge is narrow. So to push lingually, on the mandible lingual side, in the area I want to place, left forefinger is put, so I could do drill, feeling the bone contour. So leaning toward crystal, I go through the lingual crystal bone, so I position it, and the missing part on the center, I go more on the lingual side for drilling. So like this, put a hole in the cortical and 1.8 drill, diameter at 1.8 twist drill. You have short and long version. I will use short for my first drilling. So 1.8 twist drill like this. RPM I changed to 1200, and as you can see, in the area I placed, I position it, and diameter 1.8 twist drill is used. So if it's short drill, then there could be interference from adjacent teeth, and if you therefore cannot go to the full length, then you change to the long type, the long shaft drill. Same diameter, use longer version. So it's a long with stop. And again, because there could be interference if it's mandibular anterior, then you use the longer version of the drill, and sufficient to go up to 11.5 millimeters. So I have it drilled up to that level. I used parallel pin to check the drilled position, and as you can see on the mandible anterior side, compared to adjacent teeth, it's tinted about 0.5 to 1 millimeters toward inside. Unlike this, you check the positioning, and on the upper side, on the lingual side, it's correct position. And again, this is one body implant, so path is important because you cannot change with abutment. And like this, in the adjacent teeth, incisor edge line, you check against that. So about 0.51 millimeter, it's tinted toward a lingual, and on the longitudinal axis, the path is like this, and this is guide pin. So checking the final prosthesis, it's helpful because it looks same as the implant. So you push in the guided pin, and like this, the upper part, narrow ridge type MS fixture. The design is the same as I told you, so it's helpful in planning your final prosthesis. So it's a more better guide pin for doing that. Again, I'll check with the depth gauge, the depth. And as you can see, it's sufficient, drilled up to 11.5 millimeters. And then, in the lower anterior side, let's assume it's normal bone. So 2.5, 11.5 MS implant will be placed. I will use no mount driver, and no mount driver, I use the long type. And change to the placing mode, and it's marked with the triangle, and that needs to connect the MS fixture's flat part like this. Connect, and you pull it out, and like this. Before pushing in the mouse, you check that it's in the correct mode, and then place the implant. If the bone is too hard and placement cannot be done fully, then sometimes you stop and you use 2.3 level higher drill. You can use that even if it's not full length. And if you cannot take it out easily like this, then in such case, if there's a jamming, then like this, using the separator, you put in the side and you increase lever action, then easily it can be disconnected or separated. And then I use this torque wrench. And you do the placement. Final positioning. Again, this triangle exists in torque driver, so the position of the final prosthesis can be checked. And let's see whether it's aligned. Gingiva height is 2.5 millimeters, and I'll do suturing. Very simple suturing. Like this. An MS implant is placed, and now you can create provisional restoration. Next, let's see the provisional implant sequence, and I'll show you how it can be bent. So I'll put one on the molar area, crestal incision, and then flap is elevated. Lance drill is used. So after placing implants, I have to put in provisional, temporary So I will sort of not to show you how it's bent. 1.8 diameter twist drill is used. RPM 1200, like this. So positioning intentionally this way to show you bending. And provisional MS implant 2.5, 10 millimeters, no mount driver, short type. And again, change the mode placement. Open it. Same again. Even if it's provisional, the marked area connect to the flat area of the fixture. And check the mode, whether it's correct mode, and then place. I sort of intentionally, as I said, gave the angled position. Like this. And again, here also, excessive torque result in not being able to separate, then handpiece, removing that is easier. So you remove the handpiece using the separator, push it in, and then you can easily separate the two. Again, because it's one body implant, if there is a jamming, then if you force it out, you will lose stability. So you have to be careful. Depth adjustment. So depth is adjusted. And like this, in case of provisional, if the path is not correct, that the backside of the depth gauge can be used. For provisional implant, you don't like the positioning, then you push in depth gauge like this to bend the implant to the position that you want. Like this. Again, it's bendable. But if bending results in such fracture, then denture type fixture driver, you have the no mount driver. Then for denture, you can use this. You connect, and you have hexagonal nut on the provisional bottom side. So you push this in the reverse mode, then it can be easily removed. So while using provisional, if there is a fracture, then using this denture type, you can easily remove the fixture. So let's answer some of the questions related to MS kit. Dr. Shinuseo says, do you frequently use MS denture type? I do believe I told you in the lecture. So the case of MS implant denture type, in overdenture O-ring connection is where this implant is used. But recently of the overdenture, locator and other connections are readily available. So recently O-ring type overdenture is not that used as much as in the past. And also MS implant denture type, because it's one body system, just in case. MS implant denture type and the upper part, if the head is ruined, then you have to remove the fixture. So in my opinion, rather than use for wide cases or many cases, if you have elderly patient with narrow ridge, in other words, if it's not for long-term use, but elderly patient, narrow ridge, then selectively you can opt for this. Then depending on the case, it can be very helpful.
케이스에 따라서 도움이 되는 그런 형태라고 말씀드릴 수 있을 것 같습니다.
Next question. MS fixture, can you place it in areas beside the mandibular anterior? In my hands-on and other things I showed you was mostly limited to the mandibular anterior, but this is one-body implant, and because of your alignment with the upper part, the path and direction needs to be carefully determined. So in the upper part, in case of lateral incisor, if the space is narrow, or in some cases, if there's a congenital missing premolar, pushing the posterior teeth toward front, and space is narrow, selectively you could opt for this. So besides a lower anterior part, the narrow part, then selectively it can be very beneficial. One thing I would like you to be mindful is that MS implant again is one body system, meaning fixture and abutment connection is not there. So you have to set the right direction considering the upper part. So I talked to you today about MS Kit and did some hands-on practice, and we also answered some questions. So if I may give you a summary of MS Kit is for like mandible anterior narrow ridge, and if it's narrow space, it can be used on a selected cases, and one body system. So it's a mini implant with a narrow diameter. So upper prosthesis needs to be taken into considered and used for selective cases. In such cases, it can be a good option. I hope this has been helpful in learning more about MS Kit. Thank you very much.
지금까지 경청해 주셔서 감사합니다.